who've been in here before, you know that my older daughter was in charge of the video. Today, giving her a break, and my girlfriend is filming today. So she's also going to keep an eye on the chat. So if you ask any questions in the chat, she's just going to wave to me because I welcome questions at any time. So please feel free to ask questions of any type. You can use the chat to ask questions or take yourself off mute. So these hour-long classes go by very quickly. They're really just a preview. Obviously, acupressure and traditional Chinese medicine is a huge field of study. As an example, my acupuncture master's degree took 4 years. So we don't have enough time to get really into the nitty-gritty of all the theory today. So what I would like to do instead is really give you hands-on application that you can do. And for these hour-long classes, I've been really focusing on self-treatment. These are all things that you could do with your clients as well. But while many of us have been taking a break from massage unless we've been doing medically necessary massage, I know many of us are transitioning back now. But this is a great time to really focus on the self technique. So with that, let's get started. Um, very quick introduction of myself. I just briefly mentioned that I'm an acupuncturist. I'm also a massage therapist. I've been practicing for, gosh, this is going to age me, but 30 years now. Um, and many of you know that I teach full-time an entire massage therapy program for the last 15 years. This acupressure medical massage that I'm about to show you is a modality that I created myself that's based on traditional Chinese medicine and acupressure points with shiatsu and activating the points using a handful of massage techniques, including pin and stretch and myofascial release, and really warming up and opening up the whole channels. So with that, let's get started. And are there any questions? All right. So today we're going to focus on the feet, ankles, knees, and hips, which is really a lot to cover. So we're not going to get to all the points in those areas, but just something we can really apply right away. Acupressure, just a very quick background. Acupressure is great for pain management and treatment of diverse techniques. One of the great things about acupressure is that you can really get to the root cause of problems. So if you have any questions about what it's good for and what it's not, please ask me in the chat or out loud or privately, and I'm happy to spend more time on that. Again, I'm not going to focus on all the background here. I included a video of my first class, which I went over more of the theory and background, and I'll share that again at the end of this one if anybody wants to go over that more. But we're going to get hands-on here right away. So many of you know that acupressure uses primary meridians in the body. There's 12 primary meridians, and they're bilateral, so they exist on the right and the left side of the body. And we're going to be treating both sides of the body today. Most of the pictures that I'm going to use, just a heads up, is from A Practical Guide to Acupoints, which is a book that I recommend because the level of information I think is really great for massage therapists, and it has really great diagrams that are very clear about where to find the points. They kindly allowed me to use their pictures in this presentation, so these pictures are used from their textbook with permission. So let's get started. Let's get hands-on. So our camera angle is not always going to be able to catch everything I'm doing at the same time. So this first move, you're going to be treating the back of your head at the same time you're going to be treating the back of your knee. So I'm going to be using my feet to treat myself for most of this, but this first technique, I'm going to also grab the back of my head gently. And so this first point, urinary bladder 10, is on the back of the head. just less than a thumb width inside of your hairline, just on the lateral border of trapezius. And those of you who are new to Zoom, you can flip through your views so that you can see the PowerPoint pictures that I'm sharing at the same time you can see the video of what I'm sharing. So this urinary bladder 10 is what you're going to gently squeeze with your hand on the back of your neck, while we're also gently going to use the back of our knee.
You show it on the model.
Yeah. So on the model, I didn't, my 10-year-old builds most of the muscles, and she didn't build the muscles for this one, but it's going to be right at the base of the skull, just inside of your hairline, just on the lateral side of trapezius. And so what you're going to do, and I'm going to skip to the next slide here also, is that you're going to, and my camera's going to catch briefly here, you're going to be squeezing at the back of your head gently, and then at your knee, the back of your knee, right in the middle, like on the PowerPoint that I'm showing, is urinary bladder 40. So you can gently use your finger pressure here. Of course, we all know this is a caution area or an endangerment zone, depending on what term you want to use, because there are arteries, nerves, and blood vessels there. But it doesn't mean that you can't touch it. So with your toes or your fingers, and I'm going to flex my toes and gently have them right in the back of my knee, I'm gently holding there while I'm squeezing the back of my neck. So while we're doing that, and what I'm going to tell you to do with the back of your neck is if you could make a rolling, squeezing motion like petrissage. So you're rolling from superior to inferior through your neck while you're holding it. And as you can see, I've got my arms supported and my head supported, so I'm trying to relax and not have to use your, erector spinae, your trapezius, so forth, to hold your head upright. So you're gently pressing urinary bladder 40 in the middle of the back of your knee with your fingers or your flexed toes while you're gently squeezing the back of your neck. Now, if you have different massage tools like a tennis ball or foam rollers, any of these points really, you can also use those tools. But today I'm going to focus on showing how to do this with your own hands and feet and toes and so forth. But if any of these points are, say, hard to reach on yourself, you don't stretch that way, or you've got an injury or whatever, feel free to just use a tennis ball or a foam roller. Are there questions so far while we do this? All right, great. Everybody whose screen I can see, you look like you're doing a great job. Now that you've warmed it up, go ahead and just steady squeeze and hold. So your hand is supporting your suboccipital area while you're gently focusing on urinary bladder 10 bilaterally left and right. And you're holding steady on urinary bladder 40. Beautiful. Now, if you're in a position where you can do this, and I often do this when I'm lying in bed, when I first wake up or I'm going to bed, you can try different positions like laying on your side, laying on your back, laying on a sofa. But if you're in a position right now where this is comfortable, go ahead with just microscopic movements, like only moving a few millimeters at a time. If any of you have done Feldenkrais, it's that sort of very subtle movement. You're going to go in a very subtle extension and flexion, like a cat-cow in yoga, or making a rainbow and spoon alternately. So you're flexing and extending your spine and your sacrum very gently. So like a very subtle cat-cow while you're still on those same points, urinary bladder 10, urinary bladder 40. Very subtle movements. We're not doing a big cat-cow here. Excellent. Questions? Great. So what condition does this treat? Excellent. So it's a great question. So on this urinary bladder 40 sign here, it says activate and open the meridian and alleviate pain. So what that means is this next series of points that we're doing on the urinary bladder is going to open up the entire urinary bladder and treat anything along it. So this is a double stripe on the back that goes all the way down the posterior legs and all the way to through the Achilles tendon and the plantar fascia. So this is going to treat anything in the head and neck, shoulders, back, including low back, through the sacrum, through the knees, all the way to the Achilles tendon. So if you happen to know the anatomy trains, this very much corresponds with the superficial back line. So anything along that meridian. In addition to those fascial connections and those neuromuscular connections, the urinary bladder is also in a yin-yang pair with the kidney meridian. So anything that the kidney meridian treats, opening and supporting the urinary bladder is going to be helpful. So we don't have time to go into all of the things, but a couple things that come up for kidney is chronic low back pain, and any kind of lung issues that are not supporting the lungs from the kidney. So asthma, respiratory distress, chronic issues with the lungs. Does that answer your question, Kara? And are there follow-up questions to that? All right, so we're now moving down to urinary bladder 57. So this is where the heads of the gastrocnemius come together. And so again, you'll see that activate and open the meridian and alleviate pain. So that means that these points that I've chosen on the urinary bladder are really exceptional at opening up the entire channel. So again, you want to think in terms of not just treating locally, but those connections. So say somebody gets tension headaches, you can open up these few points to really open up the entire urinary bladder, and that's going to address their tension headaches. Or vice versa, something lower down in the channel, including knees, hips, low back. So this one's pretty straightforward, very easy to palpate, of course, where the heads of the gastrocnemius come together. So you can palpate going superiorly up the Achilles tendon to where the heads of the gastrocnemius come together. And, you know, again, you can use your own hands with this. And I'm going to today focus on showing you how to use your feet. So I do this, like I said, usually laying in bed, but today I've just got my feet propped up. So, you know, you can also use this in the sofa. So we're going to warm up the channel. If you're using your heel or your foot, you can just roll it through the tissue like you would use a foam roller. So I like to dorsiflex my foot to get more strength from my ankle. So this urinary bladder goes all the way through the gastrocnemius, all the way through the calves, all the way through the Achilles tendon. So once you've warmed it up, then you can really sink into that urinary bladder 57 where the heads of gastrocnemius come together. Now, once again, whatever tool you can really access that with. So right now I'm going to focus on this ball, this edge of my foot, and really sink into that point. You could see how this would be a great point. You could also sink in with a tennis ball or a foam roller. So once you're in that point, we're going to start doing some medial and lateral or internal and external rotation of the hip. So you're sinking into the point, and you're rotating your hip at the same time. Now, as far as pressure, this is a yang point, and generally the yang points you can use more pressure. So you should never go so hard that you're tightening other muscles in response, but you can use enough pressure that you're getting a good sensation on this. Now you can go ahead and, still sinking into the same spot, plantar flex and dorsiflex. And while we're doing this, are there any questions on this one? Is anyone tender in any of these points? All right, so this next point, urinary bladder 36. Again, these are exceptional points for opening up the entire length of the urinary bladder meridian. And this one is right at the ischial tuberosity, right at the inferior fold of gluteus maximus. So if you have a tennis ball, you can put a tennis ball here. Now this one's going to be hard to show on a camera, but I can show you on a model. You can keep your foot still under urinary bladder 57 while you do this, because we want to open up the whole channel at once. And with your fist, you're going to be under ischial tuberosity. So just sliding your hand under your own sits bone. Of course, all of the hamstrings attach here. And this is urinary bladder 36. And nice thing about your fist compared to a tennis ball is that you can really change your angle. So you can be more on the side or flatter, and really kind of shift it to what gives you the optimal pressure, and even, scoot your butt around a little bit if you need to. So get that in a position where your fist is relaxed, but getting into that spot well. And I highly recommend, and what I'm going to do, and I recommend you give that a whirl, is at the same time, you still continue to use your other foot under UB57, and we're going to also dorsiflex and plantar flex. So we're going to be doing those things at the same time. Another question? Trying to use your thumby, awesome. Yes, definitely. Yeah, the thumbies are great. So yeah, I would say try with any tool that you want. So I'm going to catch up with you here now, and I'm going to continue UB57. I've got my foot there, and now I'm getting UB36 at the same time. And I'm going to dorsiflex and plantar flex. Are there any questions or comments? How does your UB36 feel? All right, now we are going to move this one more point, a series of points here. We do not need to know the names of all of these because that's kind of a lot all at once here. But I have a picture showing you that there's 2 rows on the left and 2 rows on the right in the sacrum for urinary bladder points. So the more medial row is right actually in the sacral foramen, and the lateral row is starting right here at that dimple of PSIS and going down from there. So now what we're going to do, that we've really warmed things up, is more of a myofascial release move. So you're going to use your hands in a flatter kind of craniosacral kind of supportive manner under your sacrum on these points. So position your hand in whatever manner is comfortable to rest with these points, and we're going to have a little still MFR time. So my foot is going to still be on UB 57, while my hand is going to be on those sacral points. And would that help release ilio? Is my foot propped up? I'm going to answer them in order. Yes, I've got my foot propped up. So I've still got my right foot massaging my left UB57 at the heads of the gastrocs. My foot is propped up while I'm doing the sacral points. Now, like I said, I very often do this in bed, but you can also do this on a sofa or just with your feet relaxed. You can even do this while you watch TV and really experiment with positions. I'm positioned exactly like this today just for the sake of the Zoom meeting, but when I practice this on myself, I'm often changing positions in bed. So, oh, that's awesome. Tina's saying she does these points in the tub. Way to be creative with that, Tina. Thanks for sharing. Would this help release the iliopsoas? You know, that's a very interesting question, and I think it can help release the iliopsoas. So let's take a minute with these points under the sacrum and do some very gentle rocking of our pelvis. So while your hand is under your sacrum on those urinary bladder points, you're going to very subtly, like in just a couple millimeters at a time, like a Feldenkrais move, you're going to very gently do some posterior rotation. And while you're doing the posterior rotation, let your pelvis, this is going to flatten out the curve of your low back. And while you're letting that settle in, this would be a great time to visualize something that helps you feel peaceful and safe and relaxed and connected to nature. And settle in and breathe into that with a little posterior rotation and some nice deep breaths. Couple breath cycles at least. Excellent. Are there questions or comments? All right, and we're going to take this down to the end of the this meridian is going to go out the Achilles tendon on the lateral side and then out the fifth toe, the little toe. So this UB60 point, if you find the tip of your lateral malleolus and go just posterior to it, in front of or anterior to your tendon is UB60. Interestingly enough, kidney 3 is on the exact same spot on the medial aspect, and this is a yin-yang organ pair, so you can actually squeeze both at the same time. So for example, if you were to cross your leg or whatever position is comfortable for you, you could squeeze the medial and lateral aspect at the same time. And we're going to first slide through that tissue, squeezing, and then squeeze it while doing plantar flexion and dorsiflexion. Now, I promised you I would show you a lot of feet, and this next move might feel uncomfortable at first or just seem weird, but with practice, you can actually put that space between your first toe and your second toe and relax and squeeze with that. So you first, it's probably going to feel awkward at first because many of us haven't done much massage with our own feet yet, but with practice it becomes less awkward. If you want to try that with your feet, you can also try that with your hands. Now we can also focus just on one side at a time. So if you want to just focus on the urinary bladder side first, remember that's the lateral side. So I've got my big toe sunk into that UB60 space, and I'm going to do some plantar flexion and dorsiflexion. If it's uncomfortable to do kidney 3 and urinary bladder at 60 at the same time with your feet. Oh, thank you for sharing that feedback about the sensation. Now, how is that sensation going that felt electric at first? I want to make sure it's not like sharp shooting. Now, this urinary bladder is going to go out the lateral side of your foot. So at the fleshy spot under the bone next to your 5th metatarsal bone is UB63. You can rest your foot on that and then take that all the way out to your feet. So in my previous classes, we've been doing all of these moves bilateral, which is a great way to do it. Would you like to practice everything we just did on the opposite side of the body or move on to new points? Anyone want to chat or speak out loud? Repeat all this opposite side or move on? Anybody? I got a new points, repeat other side, new points. 3-1 so far. Anybody else want new points or repeat other side? Move on, new, move on, new. My girlfriend's counting them, I hope. Most of them are moving on. Okay, so we're going to move on, folks. You know, when you're taking your time with this on your own, I highly recommend that you do this bilaterally. But in the interest of getting through as much material as possible today, we're going to move on. All right, so kidney 1 is a crucial point. And for those of you who know foot reflexology, it correlates to the solar plexus point in foot reflexology. So I'm showing you on the PowerPoint first before the model where the thick skin meets the thin skin on your foot. This little shape right here, it's at the base of this. So right in here. And, you know, we've talked about this in my previous classes, but I know you haven't all come to them. So a lot of times people think about acupuncture points or acupressure points as these little teeny tiny points. But it's interesting, in reality, they're all different sizes. So some of them are as small as a needle, for example, on the ears or right next to the nose. But other points, like this one, are really quite big points that very much relate to the fascia of the body. So these are not just theoretical energetic points. These very much physically correspond to activate and open the fascia of the body as well. So with this one, you can really think in terms of how that Achilles tendon fascia goes around the heel or calcaneus and into that plantar fascia, and we really want to open up this whole area. Now, the yin energy, like the earth energy, really comes initially from this point. So it's very grounding and it tonifies all the qi, yin, and yang of the kidney, as well as opening up the meridian. Well, I said this earlier, but I'm going to repeat it because we've come from the posterior urinary bladder in the back line all the way around the Achilles and the heel through the plantar fascia to kidney. And very interestingly, urinary bladder and kidney are a yin-yang pair. So it's interesting, these fascial connections were really mapped out thousands of years ago. So our yin-yang match or opening is right here. And so to repeat, clinically, There's many different things that can happen when you have a kidney yin deficiency or a kidney qi deficiency, one of which is low back pain, chronic low back pain. You can also manifest with menopausal symptoms like the hot flashes, can be a kidney yin deficiency. Infertility can have a kidney issue with it. Lung conditions can have a kidney deficiency aspect. So insomnia, anxiety, so many different things. You need to really root that kidney. Does that bring up questions when we need to be working with the kidneys? Oh, hi, Lucy. I didn't see you before, but I see you saying you wanted to move on to new points. All right, so once again, I promised you some work. So again, this may seem strange if you're not used to it, but you can really use your own feet, including I use my heels a lot, to get into your kidney one. Now again, remember this is a nice big fascial point. So just like you want to warm up the fascia for massages, you want to warm up the fascia here. So what I'm doing is really circling into this point. Right now, my right heel is circling into my left foot, but be creative and use good body mechanics. So just like you want to make your massage as easy as possible, same thing here, you want to make your massage as easy as possible. So for example, what you can't really see in the camera that I'm doing right now is using the strength and weight of my right foot to make this work really easy. So my right foot is just really sinking in there with the whole weight of my leg. And now you can do some flexion and extension of your toes to further open up that point. And there's a question from Virginia. Yes, does that mean we need to activate kidney 1 in case of kidney deficiency? I would say yes. So in many cases of a different organ and meridian deficiency, you want to treat multiple points on that meridian to really open it up. And some points are more tonifying than others. And kidney 1 is very tonifying, as are kidneys 2, 3, 4, 5, and 6, the next ones I'm going to show you. Does that answer your question, Virginia, or are there follow-up questions, Virginia, before I field the next question? Does that answer your question, Virginia? Okay, great. You're welcome. Diane, question. So would this help with asthma or is it contraindicated? Yes, very much helps with asthma. So in asthma, the kidneys are not rooting the lungs. So we really need to tonify all the yin of the legs, including and especially the kidneys. So kidney 1, 2, 3, 4, 5, 6, the next ones I'm going to show you, are all excellent for asthma. And actually any kind of respiratory distress, insomnia, anxiety, this is all excellent for rooting that. Does that answer your question, Diane? Is there a follow-up question? You're welcome. All right, so these next points I very often treat with my own feet. I suffer from anxiety, asthma, insomnia. I very much frequently need to root my kidneys. And I also get restless legs when my kidneys are not rooted. And I am turning 50 years old this year. I also am in menopause and have the typical kidney deficiency of menopause. So I treat this on myself every day, multiple times a day, and it helps a lot. So this is the kind of thing where to build kidney chi takes time. Some things you can treat, and because of endorphins and so forth, like pain, you know, if you've got a headache or something like that, very oftentimes you can use these points and see some immediate improvements even though you still need to treat over time to really get to the root cause. But something like kidney deficiency, you need to keep treating that over time. So think in terms of every day, not, one treatment and it's all better, which is one of the reasons why it's so great to treat yourself. Um, so in between, your treatments where you go see someone else. So on my slide, I'm highlighting kidney 3, 4, and 5. So we already talked about kidney 3 being in the exact opposite side of the body, so medial side from UV60. And then in this entire calcaneal region are great points. So if you're treating with your own feet or ankles, I recommend that you roll or slide through the area first. So this whole area, you want to warm up and slide through first. And then really start getting some movement. So your inversion and eversion, your dorsiflexion and plantar flexion, and your rotation. So really get it warmed up and moving in there. Now, of course, if you can reach your own, this area with your hands, with your leg crossed, or however, you can most definitely squeeze this with your hands as well. One reason I like to use my feet so much is because this is a lot of pincer grasping. So if you're to use your hands, it's one of those things where you might overuse your thumbs. Now I'm going to go to the next slide here. We already talked about kidney 3. Some of these are just, oh, is there another question? Oh, we answered that one. Thanks. Okay, so we focused on all of these points at one time, but just to call it out, kidney 5 is just below kidney 3. We already went to this whole area. Now, I'd like to show you 2 more kidney points, and I apologize, I don't have slides for them. But while we're opening up this whole area, I would be remiss if I didn't show you kidney 2 and kidney 6. So we're on the medial side again, so big toe side. Right under the navicular bone where it's fleshy is kidney 2, and anterior and inferior to the medial malleolus is kidney 6. So we want to open up, as we're going around the heel, we want to open up kidney 6 and kidney 2 as well. Are these points tender on anybody? They're tender on my film crew. All right, so could you scoot down on this next one? So now that we've warmed it up, I want to show you my favorite part of the treatment. And this is where, if you're laying in bed or you're watching a movie or a show or whatever, you can really take your time. So what we're going to do now is, with the weight of your right foot on your left foot, just relaxing, you're going to stretch that tissue. So myofascial release, holding it to its end point, and very relaxed because you're just extending your right foot into it. You're just going to relax. And if you were laying in bed or watching TV, you could spend a good 10 minutes just on this part of the treatment. Oh, that's interesting, Tina. You might want to open up superior and inferior to that, or proximal and distal to that. So here I am on kidney 6 is where I started, but the same kind of thing can be said for kidney 2. So now at the navicular bone there, I'm just going to rest my foot in it and stretch that out. And then same thing for kidney 3 through 6. The same kind of deal can be done. So questions on that one? Now, connecting yin and yang meridians is always a good idea, and opening proximally and distally, or superiorly and inferiorly along a channel, is always a good idea. So while I'm right now just showing you this myofascial release on 1 or 2 points at a time, you can always do like we were doing before, where you have a fist or a tennis ball or a thumb bee, some kind of massage tool or another part of your body opening up one of those other points. So kidney and urinary bladder, for example, are related. So we could even be, as an example, treating UB36, that one at the ischial tuberosity, or UB57, the one at the heads of the gastrocs, things like that at the same time. Samantha, is that 5 or 6? Currently, I'm at the navicular bone, which is kidney 2. But just a minute ago, I was inferior and anterior to the malleolus, which is kidney 6. And then kidney 5 is just below kidney 3. Does that answer your question, Samantha? Now, all of these points have a lot of things they can treat, and I'm kind of trying to keep it simple. But while we're focusing on kidney 2 and kidney 6, I want to call attention to the fact that those two are particularly good at tonifying the yin aspect of the kidney. And kidney 2, for example, can also clear heat. So in the case of, say, menopause with the hot flashes, you want to clear the heat and tonify the yin. So you would want to make sure to include kidney 2 and kidney 6. But rather than losing sleep over memorizing what 365, points do, you're going to have the effect if you open up all those major kidney points, right? So whether it's more of a yin issue or a yang issue or a qi issue, if you open up and treat kidney 1, 2, 3, 4, 5, 6, you'll address all of those aspects with the type of opening where you warm up the tissue, you do range of motion, and then you do MFR. So that's going to really open up that whole channel. Oh, you were looking at the picture of kidney 5 and you were confused. The picture of kidney 5 is confusing because it's on a picture of kidney 3 that was modified. So let me call that out to you. I pulled up that picture again. So here's kidney 3, just lateral to the tip of the medial malleolus, and then kidney 5 is just below it. Does that clarify what was your confusion or question there, Samantha? All right, so once again, we would typically treat bilaterally, but so that we can cover more ground, we're now going to move on to spleen. So spleen is also one of the three, one side is more tender than the other. That's interesting and common. So to answer your question, Sam, kidney 6 was not on the diagram. Kidney 6 is anterior and inferior to the medial malleolus. There are very few points in the body where the Chinese and Japanese location is different. Kidney 6 is one of them, and I like the Japanese location, which is in this soft, tender depression between the bones. So medial malleolus, so big toe side, anterior and inferior. So right in here is kidney 6. And we were not looking at a diagram of it. So kidney 3 is back here, posterior, and kidney 6 is up here. Does that clarify it for you, Samantha? And yeah, oh good, Diana, I'm glad that clears up that confusion. All right, so spleen is one of the 3 yin meridians on the leg, and you're going to want to tonify it in many cases. So just some examples. If somebody is depressed, 9.5 times out of 10, part of the issue is the spleen issue. If somebody is having some kind of swelling issues, low energy after eating, poor appetite, which for some people gets masked as this wanting to eat junk food and sugar a lot. So rather than not feeling hungry at all, people craving like sugar and junk food. These are all examples of spleen issues. Any kind of menstrual irregularities or difficulties at all, any kind of infertility issues, all of these things usually have some spleen issue as part of it. So even if you're not doing detailed, say tongue and pulse and looking at all of their symptoms, if somebody has any kind of depression going on, you can think, well, part of it's probably a spleen issue. And just treat the whole meridian. We're going to look at some major points here, spleen 1 through 9. You can just open up all of those points for any of those things. Does that bring up other questions about what you might treat these points for the spleen? All right, so spleen starts at the big toe. I'm going to show you on this model, and the points are also in the pictures, and then I'll show you some treatment. So spleen 1 is going from out on the big toe under the bone. Here's 2 at the base of the metatarsal, and then 3, and then 4, and then 5, and then 6. So the diagram's there as well, and we'll slow this down for treatment. So I showed you quickly, not expecting that you would get every single point, but with massage, we really want to, whether it's shiatsu or acupressure medical massage, we always want to think in terms of really opening up the whole channel. So we're not just treating 1 or 2 points, we're opening up the points along the way. So all the way from the big toe to the base, on the base here, and here, and here, and then up here. So with my foot, I often treat with the side of my foot. So this foot, either my heel, if I really want to get point specific, or this foot fits this foot really well. So if I want to treat the whole length of it, I can get my foot shape to match my foot shape. So first I'm going to run through those spleen points with my heel. And then I'm going to get some movement going. So you can do your flexion and extension of your toes, your inversion and eversion, and your plantar flexion and dorsiflexion. So again, this might feel awkward and weird at first, but I'm using my flexed toe to treat these points. And then I'm using my movement of my other foot like pin and stretch. So right now I'm focusing on spleen 3, which in this diagram is right here. And this is called a yuan source point, which happens to be particularly tonifying. And then moving down to spleen 4, this point is famous for issues that are generational or familial. And I would say that even extends when we're really dealing with collective trauma like we are right now. So not even just the generational things in your own family, things that are common like alcoholism that run in families, but also these collective traumas that we're processing right now. So I would say a huge number of your patients right now, as you're really helping them with spleen and all of their, PTSD and emotional triggers right now, that you definitely want to focus on spleen 4 as well. And then I'm going to cover one more point and then see if there's enough questions to take up the rest of class. And if not, I'll show you more, but I want to leave you time for questions. My favorite point in the whole body would be a great place to end. So spleen 6 is called San Yin Jiao, And it's called San Yin Jiao because all 3 yin channels of the leg cross here. So if you find on your big toe side, the medial malleolus mountaintop or tip of the medial malleolus, you're going to go this far up from it. So all 4 fingers together from the malleolus, posterior to the tibia in a soft depression. So if you slide up and down behind your tibia, there's a soft spot there that on many people is very tender. Now, again, you can treat this with your own hand, your fingers together. You can treat this with your own foot. But you really want to warm up this whole medial aspect just posterior to your tibia before you just focus on just one point. And if you want to go all the way up to where your tibia goes up, it's going to push you into a very tender depression. Be more gentle with this. This is a yin meridian, and these require more gentleness. And then you can really, once you've warmed it up, then you can really focus in on that point. How many people are tender on that? And by the couple people said they had to go prepare for patients. Have great sessions today. Thank you. All right, so once you've warmed up, I recommend that you sink into that point gently with some MFR. Yeah, somebody says very tender. Another person says very tender. And you get referral to your heel. Thank you for sharing that. And tender, yeah, very tender, achy. Thanks for sharing, folks. All right, so while you're relaxing into some myofascial release in that point, we have just about 7 more minutes left. So I'm wondering if there's some questions. Anything you'd like me to answer, or shall we just move on? And hi, Norma. It's great to see you all massaging yourself. How are you feeling after this short amount of treatment, even though it was only one side of your body? How are you feeling overall? Any differences? And how does your left side feel compared to your right? Yeah, Natalia, that's a great question. Yeah, all of these spleen points are fantastic for fibromyalgia. I would say of all the meridians, spleen is #1 treatment for fibromyalgia. And this entire row, all the way from spleen 9 down to spleen 1, are especially effective. And treat the whole row of them, just not 1 or 2. Yeah, great question there, Melissa. Clockwise versus counterclockwise, let's say you're circling on a point. You know, people have different theories, but from a traditional Chinese medicine perspective, the clockwise is tonifying and building energy if it's depleted, and counterclockwise is dispersing if there's a blockage. So an example would be if somebody had like a real tight, stiff muscle, let's say they had a tight Achilles tendon, then that would be more of a blockage, where the counterclockwise would open it up. By contrast, if somebody had a depletion, like a chronic condition, then they would need more tonification. If you're going to think in terms of clockwise versus counterclockwise, I personally don't think that's the most essential aspect of differentiating that building versus dispersing, though. But just to answer your question. Ah, that's interesting, Diana, about the acute pain. Yeah, it's interesting that you felt that. Very interesting. Yeah, so there's this particular, there's a lot of points in the body that are great for treating pain, as you know. But why is kidney 5 especially good for acute pain? Well, every meridian has a point on it called a chi cleft point, and the chi cleft points are particularly good for acute pain. But once again, I would say very much with the caveat of you still want to open up the points distal and proximal to it, right? Unless there's a local contraindication. But definitely hitting the she cleft points, even for things like, menstrual cramps or an acute headache. And, one of the brilliant things about acupressure is that you can use these powerful points in areas that are, distal from areas that are contraindicated. So say somebody has something locally contraindicated, you can still treat effectively that problem knowing the meridians and how to treat it in an area that's not contraindicated. And so while somebody very recently asked about fibromyalgia and we've been focusing on spleen and now she cleft points, I'll point out that the she cleft point for spleen is spleen 8. So, just between spleen 9 and spleen 6, right along the midway, and if you slide up posterior to your tibia, you'll find, another very tender point. And these are great example of big, soft points that you want to be more gentle with. So great to see everybody massaging themselves. Great questions. Are there other questions, or how are you feeling while treating these points or after treating these points, and any surprises? Is anybody feeling more relaxed or more energized, or any less pain, or what's going on for you?
I feel more relaxed, and I did 22 flights of stairs a little bit earlier today, so this is perfect. So thank you.
Awesome. That's awesome. Yeah. Cool. It's awesome that you mentioned doing a lot of stairs, because I love to run, and I love all of these leg points after workouts. That is awesome that your tissue feels more open and your knee doesn't hurt anymore. Yeah, speaking of the knee, I know we're almost out of time here, but let me just tell you a really awesome knee point, because we didn't get to gallbladder yet. If you feel the head of your tibia on your lateral side, go just a thumb width inferior and anterior to it. That is a fantastic point for your knee and any tightness, whether it's your Achilles tendon or tightness anywhere in your entire body. And I'll show you on my model too. So lateral side, pinky toe side, head of the fibula, just about a thumb inferior and anterior to it is gallbladder 34. All right, somebody feels a little more energy and a little more focus. That's great. Oh, that's interesting, Wendy. Yeah, and sometimes they are tender obviously when there are shin splints, but sometimes it's just because of the acupressure points as well. And sorry, I'm trying to scroll down to any more questions. Oh, I don't see the headache question.
The headache at the top of the head feels like it wants to release.
Ah, okay. Great. So I'm going to sign off now because it's 4 o'clock, but I'll stay late for any questions, including somebody said something about a headache. I'm happy to stick around for that. But for everybody who needs to end at 4, I really appreciate your time. It was really fun to work with you as always. I'm sorry, sometimes it takes me a full week to get you your certificates. I teach full time and I'm a parent and busy, so I will get you your certificates by next week. And I am recording these, so I will also share the recordings of these with you. So thank you very much. And if anyone wants to stick around for any more questions, I am very happy to answer more questions, including the headache one. Thank you, Melissa.
Thank you so much,
Natalia. I appreciate your patience. Thank you, Chelsea. Thanks, Tina. It was awesome to see you. Thanks, Linda. Thank you, Natalia. Thanks, Renata. Thanks, Nellie. It's great to see you all. It's great to see you, Lucy. Nice to see you massaging along.
Thank you, Zephyr. Appreciate you adding me on.
Yeah. Oh, your baby's there, Norma. Oh my gosh. Oh wow. Did you massage with your baby? Thank you, AJ. You're welcome. Thank you, Sacha. And Melissa, something about EFT. Blah, 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 blah. I don't know if you were asking about what that technique is, but yeah, I was wondering if it was emotional freedom technique. So check out EFT and see if that's what it was. I'm curious. Yes, Sacha. Yes. So it is a great, Sacha, it is a great line for hysterectomy. With that and almost all, you know, women's issues, almost always all the yin channels of the legs. So spleen, kidney, liver, in almost all those cases, you know, whether it's menopausal or infertility or any menstrual issues and hysterectomy, really focus on those 3 yin channels of the leg: spleen, kidney, liver. You're welcome, Isabel. It's so great to see you. Thanks, Melissa. I'd love to hear your answer when you figure that out. Thank you, Norma. It's great to see you and your baby. And I didn't really see the headache question if someone is still here with the headache question. Willow, are you still here with the headache question or did you take off? There's somebody who looks asleep in their video. I think the treatments put them to sleep. I hear there might have been a headache question or issue. I'm happy to stay and answer, but I don't really see you or it, so let me know. Oh, yeah. Do you mean specifically emotional freedom techniques, Melissa? You know, I don't really teach it, but it seems like it might help. You know, I'm also thinking about craniosacral for your friend. Oh, I see the questions there again. Okay. Oh, gave you a crown headache. Okay. So crown headaches, you're welcome, Isabel. Crown headaches are often related to the liver as well, and also the rising. So we want to do a lot of yin on your legs. So I would recommend, give you a couple extra points here. Let's release your liver 3 and your large intestine 4. So of course, large intestine 4 is the most famous point on the body for pain, including headaches. So right there in the webbing of your hands, you can circle and squeeze and do thumb abduction, adduction, and then MFR. And then similarly to liver 3, which is between your big toe and your little toe, in the soft spot distal to where these bones, your metatarsals, come together. This is also famous for pain and headaches, but particularly because crown headaches relate to the liver, we want to work with spleen 6 and liver 3, and this one can be tender, and it's a yin point, so you want to be more gentle with it. It talks really well to kidney 1 at the bottom, which is also going to be good for your crown headache. So I would recommend squeezing these gently and then also doing spleen 6. Now I know it's tempting when there's pain in your head to kind of go directly to it, but we really want to do a lot of pain points that bring that yin energy in. And if you really feel like it's from the muscles in your neck, then of course you can massage those out as well. Yes, if you're asking to leave this part, I don't know if you mean the chat or this part at the end of class, I can leave them both in that. And I teach basic craniosacral therapy for the person who asked that. And Willow, how's that going? Are any of those points helping? It's really sweet. Somebody fell asleep while doing this class. I hope it was the points. Somebody who's sharing their video is asleep. That's really sweet. Oh, I'm so glad it helped, Willow. Yes, and I'll save all this. Okay, so I'm just sticking around late for late questions. So any more questions? There's one person sleeping, and I hope it was the class that helped her relax, and I don't know if we should wake her up. It's so sweet. I think we'll just let her sleep. Eventually, she'll know that class is over. Oh, she's moving. All right, everybody. Well, that's so interesting. Yeah, Willow, that's great to know. Yeah, and they like it gentle. And yeah, you can always balance them out. So now, great thing about that Willow too is the yin yang pair of spleen is stomach. So you can also balance it out with stomach. The most famous stomach point is stomach 36, which is just below the knee dimples this far, right in tibialis anterior. So just lateral to the crest of the tibia. And so that's a great point to balance your spleen with as well, if you ever feel that way. All right. Well, thank you, everybody. I'm going to end the meeting. It is being recorded. It was awesome seeing you all. It was great to work with you. Thank you, Natalia. I really appreciate that. It was lovely to work with you. I'm glad that helped, Willow. Take care. You're welcome.